Child and Adolescent Mental Health Nursing. Unit 1, Module 2, Social Determinants of Health, How Environment Shapes Brain Development. In Module 1, we learned that the brain strengthens what it experiences most. Now we ask a deeper question. What determines those experiences? The answer is not just parenting, it is environment. An environment is shaped by social determinants of health. According to the Centers for Disease Control and Prevention in Healthy People 2030, social determinants of health include these conditions: economic stability, education access, healthcare access, housing, transportation and safety, social integration, and support systems. These are not abstract concepts. They are the conditions children live in every day, and those conditions shape brain development. The brain does not develop in isolation. It develops through repeated exposure to environment. That includes safety or threat, stability or unpredictability, nurturing or neglect, access or deprivation. Each of these experiences becomes a neural signal. Repeated signals become wiring. Children living in poverty are not just experiencing financial limitation. They are experiencing increased caregiver stress, food insecurity, housing instability, limited access to enrichment. These create chronic activation of the stress response. The brain adapts accordingly. Unstable housing introduces unpredictability. Unpredictability increases vigilance. When the brain cannot predict safety, it prioritizes survival. This affects attention, emotional regulation, learning capacity. The child is not disengaged. The child is scanning for safety. Exposure to community violence or unsafe environments can lead to hypervigilance, startle response, sleep disruption, emotional dysregulation. These are adaptive responses. The brain is learning. The world is unpredictable. Some children experience multiple overlapping stressors: economic hardship, discrimination, language barriers, limited access to care. These are not isolated risks. They accumulate. And cumulative stress increases vulnerability to toxic stress. What we often label as defiance, inattention, aggression may be adaptive responses to environmental stress. This is a critical shift from "what is wrong with this child" to "what has this child experienced?" An 8-year-old presents with frequent behavioral issues at school. The child lives in a high-stress environment with food insecurity and housing instability. Let's recognize cues, behavioral dysregulation, and environmental stressors. Analyze these cues. Possible chronic stress exposure affecting regulation. Prioritize. Address safety and stability before behavior correction. Generate solutions. Connect family to food resources. Engage school supports, and provide caregiver guidance. Take action. Use trauma-informed approach. Evaluate. Does behavior improve with environmental support? Children do not choose their environments, but their brains adapt to them. When nurses address social determinants, we are not just addressing circumstances. We are protecting brain development. This is prevention at the structural level.